What we do is we try to improve lives through 3D technologies. So primarily that involves 3D printing, but we involve 3D scanning or any of the technologies that will drop into that category. So first of all, I'm going to look at the big picture before I talk specifically about what I do with Ian at Alderhay Hospital and around the country. And that's to look at really, as I see, as a non-physician, as a non-healthcare professional, a massive problem within healthcare, within the NHS, and that's the conflict really between the desire from people like Ian to fix things, to improve care, to make things better, and also at the same time to drive some efficiencies. It's a massive conflict. How can we reduce cost while improving service? And how can we move towards personalised healthcare under those circumstances? Can we really afford to shift towards that solution? And I would say, I'm a little bit biased perhaps, that 3D printing can really help in this. 3D printing is something that can operate now, that can produce results now, I can produce a model for Ian tomorrow when I'm doing on a regular basis. And I think that model can improve surgical outcomes and also can drive some efficiencies. The other thing about 3D printing is it's a platform. 3D printing can be a bedrock of the future of healthcare. If we're talking about bioprinting, we're talking about other things that are going to be really sexy in the future for the medical sector, we need a platform to deliver those. And my idea for how we deliver those would be embed a 3D printing hub in a hospital now, and do the stuff that's simple, do the stuff that works now, but set us up for the future. Get us ready to receive and to deliver these really interesting things that have been coming in the next 10 years of time. So I'm going to talk a little bit about what we do now, and I've actually got some models with me so I can talk you through them later. But this is one example that I like to show that shows kind of what we do. And I'm trying to make this as cheap as possible and yet as effective as possible. So what I don't want to do is just make a really pretty picture of something and give it to a surgeon, because that's actually, it might not be that useful. We want something that's a tool that the surgeon can actually look at and say, okay, this can change my opinion about what I was going to do, or validate my opinion. So if you look at this here, and I've got these models with me, the one on the left is a cardiac model, and it's actually for a blocked pulmonary artery. And the one on the right is also a cardiac model, and that's for a ventricular septal defect. And I'll explain a little bit more, but they don't look the same, obviously. So the one on the right, that is a 3D print of the blood inside the heart. And that's much more useful for a surgeon dealing with a ventricular septal defect than a copy of the heart. And the only way that we would know this is if I'm embedded in a hospital, and I'm providing the technology, and the clinician is saying what he wants. So it's only by working together that the technology and the surgeon can actually produce something together that actually works. This is not expensive, and this can be done now. And so what I like to do is get more of these into hospitals, solve some problems now, but yet set us up for the future. So I'm going to run you through a couple of other things that we can do now. This is probably the simplest, and this is obviously from patient-specific data, not just a heart. This is the patient's heart, obviously, otherwise it won't work. Okay, let me move on one. So what else can we do now? And this is just a quick run through of other things that 3D printing can help with. First of all,